how's your heart? WIS is teaming up with Lexington Medical Center to help you take 5 for heart health. All right, let's go over to Christy Finns. And Christy, you go, girl. Christy's going to do a little dance here. You know, that's the thing about exercise. It can be fun, right?
You need to find something you enjoy.
Today's topic is Learn CPR. Joining us, Dr. Amy Epps, Lexington Medical Center cardiologist, and also Stanley Dowling, a CPR trainer with the American Red Cross.
So CPR is what keeps the blood circulating throughout the body, and it's vital for not only heart function, but any tissue function, and particularly brain function.
Then I'm going to place the heel of my hand in the center of the victim's chest. I'll place the heel on the other hand, lacing the fingers. Roll forward so that my shoulders are directly over my hands. Locking my elbows, we're going to deliver continuous chest compressions, 1 and 2 and
And John Leach is the cardiac rehabilitation manager at the hospital. How does stress impact the heart?
I call this behavioral cardiology. Medical research shows that stress, anxiety, depression, and anger all very significantly can increase inflammation in the body.
Today's topic is Eat Right, and Laura Stepp is a dietitian with Lexington Medical Center. What is in the whole grains that's so healthy?
All right, whole grains are an intact whole grain. It has all 3 parts, so it still has the bran, the germ, and the entire kernel, all 3 layers of it. And what makes it so healthy is because it is intact, it still has all of the fiber and the protein and the antioxidants.
Jamie Jeffcoat is with the Center for Best Practice at Lexington Medical Center. And Jamie, I mean, it is a really good question. How do I know if someone's in trouble, whether to call 911 and wait for an ambulance or to try to get that person to the hospital myself?
That's a great question. EMS now have capabilities via the radio technology. They also have EKG technology on the truck that actually help assist a patient if they're having a heart attack to get fast treatment.
This is an EKG machine right here, and what we have is electrodes that go on the patient all around the chest. So if we have somebody complaining of chest pain, we're going to put these on. It's going to show every particular portion of the heart, and we can see particularly where an infarct or a damage might be happening from a heart attack.
We are so excited to have Dr. Taylor Williams here, who is a cardiologist at Lexington Medical Center. Thank you, Dr. Williams, for being here. Let's start with how our cholesterol does affect our heart health.
Okay. Well, high cholesterol does increase your risk of heart attacks and strokes by blocking up your arteries. And what's more important really than total cholesterol that you hear about all the time is the good and bad cholesterol.
Lexington Medical Center is hosting a heart fair. Tell us what folks could expect to see there.
Our goal with this heart fair is to make it really different than most health fairs. Instead of just walking around picking up brochures and flyers, we're making it very interactive. For instance, people who attend can come and get their own personalized EKG rhythm strip. They'll sit down, we'll put the paddles on them, won't shock them, and just run a rhythm strip, and they'll be able to walk away with that.
The free event taught folks how to reduce the risk of developing cardiovascular disease. Physicians and clinicians also used heart health topics, including nutrition, heart attacks, and strokes. There were even activities for the kids who got some tips on planting vegetables for the spring.
Cardiovascular disease is one of the biggest issues in healthcare, particularly in South Carolina and certainly in this region as well.